ASAM advocates for the three pillars of our focus, which are teach it, standardize it, and cover it.
ASAM really advocates for a number of different policies.
Issues that are important to addiction medicine, our patients, and our practices. ASAM advocates that the disease of addiction in all aspects be treated exactly the same way as every other disease. Teach it means that every physician, every medical student, every resident physician in the country needs to understand the disease of addiction.
Because of the stigma that has been associated with addiction for decades, it is so important for policymakers, for families, for individuals themselves to understand that addiction is a treatable medical condition.
And that means we have a lot of education to do. So we need to continue ASAM does a great job, but continue to develop that education. We also need to fund the distribution of that education and the endeavors related to that.
We need to have policies that actually standardize that treatment so that when people actually go to seek care, that they know that they're getting high quality care.
We have too much variance in addiction treatment in the United States. So the reality of the matter is that you may go to a different part of the country and get wildly different treatment for your substance use disorder, whatever it might be.
Cover it is important for ASAM because if our physicians, if our clinicians can't get paid to perform the clinical services, then they can't do those clinical services.
Because one of the biggest barriers we now know and have to access to treatment has to do with payment policies.
You look at some state Medicaid budgets, and although the Medicaid demographic shows a high rate of mental health and addiction, sometimes as high as 1 in 5, you'll see state budgets where it's only 1/20th or 1/30th of the Medicaid budget. Well, these things that doesn't necessarily make any sense.
ASAM is at a place now where it defines what the standards are. That's what we're here for. And those standards will continually evolve and improve, and ASAM is committed to that. So in order to have the public and our legislators and family members and people who have addiction to understand addiction as an illness, we have to have a voice which is clear, articulate, and comprehensive. And that's really what ASAM offers.